The 0 hour, we like to call it, as you may have heard me say before, the voice of Medicare for all. But now, as we enter especially the presidential season, we're finding that there are some plans out there that have similar sounding names and vague, lofty, but similar sounding goals. And here to help us find our way through that maze, especially as regards one such plan, is our friend Diane Archer. Diane is the founder and president of Just Care USA. That's a website and media hub that focuses on health and financial issues, especially for boomers and older adults. She was chairman of the board of Consumer Reports and has done a lot of great things, founder of the Medicare Rights Center, and she joins us now by phone. So first of all, Diane, thanks for coming back.
Thanks for having me back, Richard.
Secondly, let's talk a little bit about this plan known as Medicare for America, or as I call it, Medicare for almost everyone. You know, that it sounds like Medicare. It sounds like Medicare for all, but this is the plan being promoted, as I understand it, by Beto O'Rourke and by Kirsten Gillibrand. Is it, in fact, this, as many people are saying, the same thing or virtually the same thing as, let's say, the Medicare for All bill put forward by Representative Pramila Jayapal or Bernie Sanders?
Actually, the Medicare for America plan is quite different in some important respects from the bills proposed by Sanders and Jayapal. So let's just run through what it is and what it isn't. Medicare for America is a healthcare reform proposal that allows people to keep the insurance they have if they want it, or if they prefer, they can opt into traditional Medicare or a Medicare Advantage plan, which is a commercial Medicare plan. And that Medicare for America plan, which is really Medicare for some, I would say, for those people who don't want to, for people who do want to give up their employer coverage, or for people who don't have any coverage. Those are the people who would get Medicare, and people otherwise would, if they wanted to, stay in their employer plan. The two big problems are that this Beto O'Rourke plan drives up healthcare costs. It does nothing to rein in healthcare prices. So prescription drugs, doctor charges, hospital charges, administrative costs, in addition, would continue to wreak havoc on our healthcare system. And secondly, it doesn't guarantee access to care to everyone. So while it attempts to cover everyone in America, which is an important goal, covering everyone, as we know, is not enough, because if people have to pay more for care than they can afford, even with insurance, which is what we're experiencing right now, then having insurance doesn't mean what it needs to mean, which is everybody has access to the care they need when they need it.
Well, and this gets to a point that I think is extremely important. And you know, you've made it, I've made it over and over again in a simple, perhaps blunt way, but that in a certain way, the Affordable Care Act, for example, was designed to fail. And by that, I mean exactly what you were just talking about. That we live in a country where 70% of people polled say they wouldn't have $1,000 to spend in case of an emergency. And yet, the Affordable Care Act, for example, provides many people with coverage that requires them to pay much more than $1,000 out of pocket before they have coverage for their medical needs. And even then, there are things that are left out, things that are excluded. They still have, you know, they may still have to pay a large out-of-pocket deductible. So that's what I mean by designed to fail, is that it's a plan that provides people with medical coverage they can't, most Americans can't afford, or many Americans patients can't afford. And I think what you're saying is that Medicare for America, the plan that's being touted is just as good as Medicare for All by folks like Beto O'Rourke, has the same problem. Is that right?
I think that's right. I think it's designed to work really well for the commercial health insurance industry, right? It gives them control. Sorry, losing my voice here. But it allows them to do exactly what we don't want them to do, which is to restrict our access to doctors and hospitals. Medicare for All, in sharp contrast, gives people the freedom to go to almost any doctor or hospital anywhere in the country, right? Medicare for America, again, the O'Rourke plan, lets insurance companies continue to tell doctors that they can't provide you with the care that your doctors believe you need. That's a serious problem. It allows the insurance companies to come between patients and their doctors. And, as you just said, it allows the insurance companies to impose financial barriers to care. So we end up with a system that is completely broken the way our current system is. And what I would like to say is that Medicare for America really keeps our broken system. And the problem, our broken commercial healthcare system, cannot be the solution. That's why we support Medicare for All, right? It does away with these commercial insurers, which are driving up costs and keeping us from getting the care we need.
Yeah, and just to be clear then, so Medicare for America, this other plan, the O'Rourke Gillibrand endorsed plan, this is a plan that still imposes financial burdens on folks and still is delivered primarily, not exclusively, but primarily through commercial insurers. Now, one of the things, whereas Medicare for All is administered by the federal government, it is a single payer in that sense. All your healthcare costs are covered. You don't have to spend hundreds or thousands of dollars before your coverage begins. You don't have to pay, out-of-pocket costs when you go to the doctor or hospital or when you need medication. So those are big differences. But I think the other dimension of it that you've alluded to a couple times is that if we agree, and I think we're increasingly agreeing as a society that healthcare is a human right and a public good, that commercial insurers are just not, by design, can't be the ones to provide that public good, because I would argue anyway that their financial interest and their profit lies in denying people that very public good that we're trying to deliver. Do you think that's a fair statement, first of all?
I think it's not only fair, but we have seen over and over again evidence that it is the case. And it is the case, according to the government's own audits, more than half the time in the Medicare Advantage marketplace, the commercial insurance marketplace for people with Medicare. And by that, what I mean is that in more than 56% of the time, the federal government has found that these Medicare Advantage plans are not properly serving the interests of people with Medicare, that they're improperly delaying and denying care to people with Medicare, that they are imposing a risk to the health and safety of people who are enrolled in the Medicare Advantage plan. And those are findings that are buried, that people don't really see. What the government will do in those instances is they'll financially penalize the Medicare Advantage plan, and they may temporarily not allow that commercial insurer to enroll new members, but they continue to allow these Medicare Advantage plans who have been found to engage in activities that are completely against the interests of their enrollees to continue to offer services to people with Medicare. And that's a problem.
And again, for people who don't know, and again, we're talking with Diane Archer of Just Care USA. For people who don't know, the Medicare Advantage plans are the private commercial insurers' ability to offer a competing plan to standard Medicare and get paid by the government to deliver care. Now, one of the things you hear people say is, well, people love Medicare Advantage. And so the theory that the private commercial insurers are somehow taking advantage of the system has to be wrong. But I guess I would counter argue, based in part on what I've read at justcareusa.org, that people who have serious health needs, you wrote, are more likely to disenroll from Medicare Advantage plans. In other words, they look great on paper, but when you need them, they're not delivering the care that you're entitled to or that they promised. Is that accurate?
That's fair. There have been two recent studies that are noteworthy. One involved a look at where Medicare Advantage plans were sending their enrollees who needed nursing home care. And that study out of Brown University School of Public Health found that people in Medicare Advantage plans who needed nursing home care were sent to poorer quality nursing homes than people in traditional Medicare. So that's some evidence that people are not being treated as well in their Medicare Advantage plans as they are in traditional Medicare. A second study, also in part out of Brown University School of Public Health, found that people with complex conditions were disenrolling from their Medicare Advantage plans back into traditional Medicare at far higher rates than people who are healthy. People who are healthy or relatively healthy don't really have to worry about how good their plan is at delivering coverage. They don't need a lot of care. But the people who are sick do need to be concerned, and they're the ones who were finding, who were likely finding that their needs weren't being met. Otherwise, why would they be leaving and going back to traditional Medicare? Now, the issue for people who do want to leave their Medicare Advantage plans is that it can be difficult because you need to have supplemental coverage in order to be enrolled in traditional Medicare in order to protect yourself from financial risk, because there is no catastrophic cap today in traditional Medicare. So your costs can be quite high if you need a lot of care without supplemental coverage.
Right. So, but these are problems with today's Medicare that are fixed by Medicare for All. So, and not fixed, I gather, by Medicare for America. So, and the other point I wanted to make about Medicare for America, I'm calling it the O'Rourke Gillibrand plan, for lack of a better shorthand. One of the other, I wanted to ask you, Diane, what is one thing I've noticed that a lot of these consultant groups do, these DC policy shops, and this was created in one, is there seemed to be a truism adopted along the way by healthcare policymakers and economists that it was okay if people paid up to 10% of their household income for healthcare, which to me is an enormously high amount. But if you've ever tried to raise a family of four on $75,000, slapping another $7,500 of expense on top of that if somebody gets sick, or more than one person gets sick, is pretty onerous. Where does Medicare for America fall out on that kind of a measurement?
Good question. So what I understand is that Medicare for America does put a catastrophic cap on traditional Medicare of $3,500 for individuals and $5,000 for families. That's still very high. And I think what that will mean if it were to pass, which I think is a long shot for many reasons, which we can get into, what it means is that people would be continuing to do what they do today, which is making choices no one should have to make between their kids' healthcare and their own healthcare, between their rent and their healthcare, between their dinners and their healthcare. It's just untenable that people are being forced to make those kinds of choices. But $3,500 is a lot of money to pay out of pocket.
Yeah, so is 5,000, needless to say. Well, we have about a minute left, Diane, and I just wanted to, close on a thought too, which is, I'm not sure why Democrats are bidding against themselves on this issue. In other words, if we have momentum towards Medicare for all, they're offering these weaker plans like Medicare for America, but it's not as if, and they're saying it's more politically realistic, but it's not as if Mitch McConnell is going to vote for Medicare for America either. So I'm not sure, I thought the whole point was to run on your ideals, and if you have to compromise, compromise. And I thought the whole point was Republicans aren't going to give you anything anyway, so why not propose what you believe in and something the American people support?
Absolutely. And let's face it, I think what every American believes, Republican and Democrat alike, is that the price is stupid. Our healthcare costs are out of control. We pay twice as much as what people pay in other wealthy countries. And if you're going to do healthcare reform right, you better focus on the prices. And the O'Rourke-Gillibrand plans, Medicare for America, don't do that. What we need to do is Medicare for all if we want to rein in prices and make healthcare affordable and guarantee people access to care. It's really a no-brainer. Kind of shocking that the mainstream media has not focused on the fact that the O'Rourke and Gillibrand plans don't address high and ever-rising healthcare costs.
Well, it's a great point. I'm glad you've made it and reiterated it. And unfortunately, we're going to have to leave it there. But Diane Archer, president and founder of Just Care USA, which can be found at justcareusa.org. Thanks for your great work in this area. And thanks for coming back on the program.
Always my pleasure, Richard. Thanks.